Dr. Silva, what would you say is the best way to communicate with terminally ill patients?
I think the best way to communicate with terminally ill patients is reaching out to them. I think the patient needs to feel the closeness and needs to feel humanity. Therefore, the way I do it is I cross the room and I put my hand on their shoulder and I make good eye contact. I speak slowly and kindly because you need to connect with the patient. The patient needs to know that you're actually there for them and you're actually giving them all the information that they need. But they need to also feel that just because you're telling them that they're terminally ill, that does not mean that there's nothing else you can do for them. So you need to make sure that they don't feel abandoned. Not in the medical sense and not in the human sense. So instead of what I call telegraphing the news from across the room and telling them, you have A, B, C, and D, and we're going to do this, 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 you walk across the room, you put your hand on their shoulder, and you look at them and their family member, and you engage them, and you explain to them what is going to come, and you give a little information, and then you stop and allow them to ask questions. And that's how you go back and forth. There will be patients that do not want a lot of information. I have patients that tell me, don't tell me more. And other patients that tell me more. So how I do is like when you throw a rock in a lake and you see the ripples of water move, I stand by them, I make eye contact, I'm engaging with them, and I give them a little information. And I see how far that takes them. I see if I lose them or if they want more or less, depending on their questions. And then I move on to the next stage, and I take it by little ripples. That way there's kindness and exactly how much information they can handle and they want to listen to in a humane way.
Thank you. And I've seen how you interact with the patients, how you just described that you touch them on the back and stuff. How do you know that you're not crossing the line with the patient, like the patient-professional relationship that you're supposed to have?
Sure. Well, it's always, all these relationships are one-on-one, and there are some patients that you will probably not be able to do that. But for the most, when the patient, especially when they're surrounded by their family, and it's a family atmosphere, which is usually what happens in the room with the patient, as you approach them with kindness, they really appreciate that. Because at the end of the day, in a terminally ill patient, most of what you can say is in a book or the internet, and what they really want is that this person is there for me. This person is going to do for me what he or she would do for their own family member, whether it be their sister, their mother, their wife, or their daughter.
Thank you. How do you feel, this might be a loaded question,
Okay.
How do you feel when your patients die?
I feel a great sense of loss. For many years, I have gone to each and every one of their funerals. And I carry it with me. As a matter of fact, when I run a marathon every year, I run in the back, I carry all their names. And I say their names in my mind and I remember them as I run. I run for them and I carry them with me. I feel a sense of loss, and yet for some of them I feel relief when they're in a lot of pain and they're undergoing a lot of suffering. But I try to alleviate that to the best of my ability, and that gives me a sense of peace, giving them oxygen when they're short of breath, morphine when they don't have enough, when they have too much pain, and so alleviating them, giving them a sense of comfort, them and their family, and knowing that I'm there for them.
Thank you. In your opinion, what is the most difficult aspect of communicating with terminally ill patients?
The most difficult aspect by far for me is when the therapies are running out and the patient is failing and the patient wants to continue living, because there are patients that grow tired and don't want any more treatment, and even though you may have other things to tell them, to give them, they're saying, Doc, I'm tired, I don't want anything else, I just want peace, I want to travel a little bit if I can, and I don't want to have pain. I want to have good days with my family, whether it's 1 week, 10 days, or a month. And then there are other patients that want to keep fighting. The hardest is those that want to keep fighting and that you've run out of medicines to give them. That is the absolute hardest point of frustration when there's nothing else, especially in the young people that I take care of, that really are full of zeal and fight and fire. and there's nothing else to give. That's the hardest, the most frustrating, the part I hate my job the most, which makes me continue fighting for them and dreaming and trying to find new ways to treat them.
Thank you. And when a patient is in denial, what do you have to do for them?
When a patient is in denial, it happens in different stages, but usually they are not listening to what you're saying. So if they don't listen, it's very difficult. So I always have a board in my room, and I write down what I say in big points. That way when they go home and they put this a big sticky, they put it on the wall and they look at it, they remember a little bit what they say. And I try to speak to their family members and to them at the same time. So it's not about waking them up or hitting them over the head with the news in an unkind way. It's a lot of times they ask you things like, so is my disease curable? And depending on their mental state and how they're doing and their fragility, oftentimes I don't use that word. I say, your disease is treatable, which is true. You can treat it, like high blood pressure is a treatable disease, instead of saying curable. And in those patients that realize or that do not realize, that they think that they will not die and they will, and you say, then you approach them and go, you know, we're running out of lines of therapy, we have 1 left or 2 left, and you let them know how much you have to do. But that's a very difficult part. When they're in denial and trying to move them out of denial, because they need to prepare their will. They need to say their goodbyes and their I'm sorries. I've had patients that haven't spoken to their brothers in 20 years, and after I communicated with them, after they were in denial, they came out, they called their brother, and their brother actually flew in from California and took care of them for that month before they died, and they were able to make that peace. So it's really important to communicate, again, the message in a kind and loving way, and oftentimes it takes 2 or 3 visits. It's not in the first time. It's not just hammering them on the first time. You got to develop that rapport, that trust, and that relationship.
All right. Thank you, Dr. Silva.
You're welcome.